Right. Hello, everyone. Good afternoon. Welcome to today's COVID-19 update for Yakima County. I'm Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Joining me today is Nathan Johnson, Emergency Response Coordinator, also from the Yakima Health District. Nathan will be providing a quick update on the COVID-19 vaccine at the end of our update. And so to begin, I'll just share some information on our current numbers as usual. As of yesterday afternoon, we have reached a total of 15,435 cases of COVID-19. This is an increase of 736 cases from our last update last Wednesday. Currently, there are 28 individuals who are hospitalized due to COVID-19, which is 6 more than what we reported during our last update. 2 individuals are intubated, and this has increased just by 1 since the last update. And we are saddened to report that an additional 7 members of our community have passed away due to COVID-19, bringing the total amount of deaths to 266. Unfortunately, we are still seeing increases in cases and hospitalizations in our county. With a higher number of cases, we also expect to see more hospitalizations and deaths. And so our message remains the same. Please continue to take steps to help prevent the spread of the virus. Mask up when you're in public places, avoid close contact with people outside your household, and stay home if you're sick. Remember that doing these things is not just to protect yourself and your family, but also will help keep our healthcare system, help it from being overwhelmed, and it'll also help protect our most vulnerable and high-risk populations. If you participated in any large gatherings recently, monitor your health and get tested right away if you develop COVID-19 symptoms. If you believe you might have been exposed to the virus, but you have no symptoms, it is best to wait to get tested at least 5 days after the last potential exposure. If you test positive, please stay at home and away from others until you complete your isolation period. If you need assistance obtaining resources such as food or other household items, or if you need other type of financial or social support while you stay isolated at home, you can call the Washington State COVID Care Line at 1-833-453-0336 for support in obtaining these services. This is a free resource available to anyone who tests positive for COVID-19 and also for identified close contacts of a positive COVID-19 case. Also, if you test positive for COVID-19 and are contacted by the Department of Health, please answer the call and participate in the case investigation process. Provide as much information as you can. This will ensure that you and your close contacts have the information and resources needed to stay home and prevent spreading the virus to others. I would also like to share that there will be a new community-based testing site available in Sunnyside at the Sunnyside Community Center. This site will open this Sunday, December 6th, and it is in addition to the State Fair Park testing site. Both sites are similar in that they offer free testing to anyone regardless of health insurance status. However, the Sunnyside site will be open during different hours. It will run from Sunday to Thursday from 9 a.m. to 3 p.m., except for Tuesdays when it will open from 12 p.m. to 6 p.m. And so for any community members seeking testing, this is another resource that you may access as well. And so now we're going to hear from Nathan, who's just going to provide more information on the COVID-19 vaccine.
Great. Thank you, Jocelyn. So we know that there are 2 companies that are currently in the process of developing a COVID-19 vaccine and not only working on it, but towards the end of completion of it. Those are Pfizer and Moderna. Both companies, again, they're wrapping up their clinical trials and they're working with the Food and Drug Administration, the FDA, for emergency use authorization in the U.S. It's important to know that once it gets that FDA approval, it will then go to the Advisory Committee on Immunization Practices, which is another federal organization that will review it, and develop guidance around that vaccine. Following that process, it will then go with Washington specifically. Washington State joined into what is called the Western Pact, and this is with other states, including Oregon, Nevada, Colorado, and California, where it's made up of health officials who have been reviewing the entire process of the vaccine development and will review the ACIP's recommendations and the FDA's approval before giving it their blessing. So there's still a lot of approval process that needs to be done from a federal level and from a state level for that vaccine. Once this vaccine goes through all that approval process, it's also important to know that we're not anticipating getting a large amount of that vaccine into our state and even into our community right off the bat. These organizations are making vaccine not only for the US but for other countries, and there's just limited production. So with that, at the federal level and at the state level, there's conversations as far as allocations and how to best allocate those. We're in constant coordination with the state about what the state's recommendations will look like when they're finally released. And then at a local level, we'll be reviewing those and ensuring that those guidelines meet our community's needs. So we don't have a anticipated timeline for or an exact date for when we'll see vaccines within our community. We know these companies are close. It could be somewhere in December at the earliest. But again, when we do see the vaccine, it's going to be limited. So understand that there will be an allocation process that we will follow at the local level to ensure that we are maximizing the use of those vaccines. Both companies, these vaccines will be a 2-dose vaccine as well. So that's important to know. So really, my biggest message is we know the vaccine's coming. There's a process of approval. We understand that there's a lot of concern or thoughts around whether the vaccine's being rushed. And just like everything with COVID, on a local, state, and federal level in response to COVID, we are having to develop systems really real time and streamline the process. It doesn't make that process any less effective. With the vaccine, for example, instead of going from point A to point B to point C, we're having to do some of those points at the same time. In parallel with each other to make sure we're able to get that vaccine developed and in our community's hands at the earliest. So our goal is to continue working with the state and federal partners to ensure that we get the vaccine that we need, and then also how that gets distributed throughout the entire community. We plan on working with our community partners, our hospital systems, our FQHCs, such as Farm Workers Clinic, Neighborhood Health, and Community Health of Central Washington, to help push out that vaccine when we do have it in our community. But it will take some time to get that vaccine, and that's why it's important to understand that even once that vaccine is released and we start seeing its initial doses in our community, that we're not going to have the capacity to immunize our entire community. So it's going to be important to continue that masking up and social distancing and following those public health measures in the interim until we do get enough vaccine in our community and we're able to spread that throughout the entire community. And that is just kind of a quick summary of where we're at. Again, it's still at the federal level. We still have a lot of work to go, and we're working with our local and state partners to ensure that we have processes developed within our county to ensure that we can push that out as quickly as we can once we have it in our hands.
Well, thank you, Nathan, for providing that information. And as you mentioned, until a vaccine is widely available, we still need to continue to wear our masks, physical distance, stay home if we're sick, and get tested. If you have any questions about this update or any questions you'd like us to address during our next update, please leave them in the comment section below. Thank you.